In this video, you will learn the causes of agitation and aggression in people with dementia. We will also talk about the strategies to cope with the behavior in different situations. And most importantly, what to do when injuries are likely. Make sure you watch until the end. The last section will talk about important information to avoid harm and keep everyone safe. What do agitation and aggression look like in dementia? Sometimes, people with dementia may become agitated or aggressive. An agitated person is restless or concerned. They do not appear to be able to relax. Pacing and sleeplessness are symptoms of agitation. Aggression is when a person becomes violent. It could be physical, such as striking, biting, or throwing items. It could also be verbal, such as swearing, shouting, or making threats. Causes of agitation and aggression. Agitation and aggression occur for a purpose most of the time. Try your best to figure out what is causing it when it happens. The behavior may end if the causes are resolved. The following actions may prevent agitation and aggression. First, take care of physical needs. Pain or discomfort is the most common cause. People with dementia may be thirsty or have to use the restroom. They could be sick, constipated, or simply in one position for too long. The surrounding is not comfortable. It could, for example, be too noisy or too hot. Disorientation causes frustration. The person with dementia may forget where the toilet is or where the sugar is kept. The person might be blind or deaf. They may misinterpret anything they see, hear, smell, or touch. The person may be experiencing hallucinations or delusions. As a result of the confusion and fear, the person with dementia may react aggressively. The person may feel angry as a result of sexual frustration. Dementia may have impacted the person's judgment and self-control. They become disinhibited or are unsure of what is appropriate behavior. Side effects from medication or drug interactions can make it difficult to express the needs. Second, take care of psychological needs. The individual may be frustrated for not doing the things they used to do. They may also feel irritated if others think they are incapable of doing things independently and taking control. Dementia patients can get angry if others pressure them to do things they are no longer capable of, such as bathing. The person could be suffering from depression or another mental illness. Changes in the house may appear unfamiliar to the patients. They may believe strangers are in their home and they must defend themselves. The patient may believe a different reality. For example, the patient must pick up their children from school, although they are adults. The individual may not understand what the caregivers are doing. They may see personal care as a violation of their personal space. Third, take care of social needs. The individual may lack social contact and be no longer able to interact with others appropriately. They may have little sensory stimulation, and this can cause anger or aggression. Change of caregiver or care routine can confuse the patient. On the other hand, the patient may dislike a particular care provider or approach. The person may not like others to mention his or her illness. What to do if the person is already agitated and aggressive? Here are some tips for coping with agitation or aggression in dementia. Some general tips are: if you are the caregiver, slow down and relax. Sometimes taking a break from the caring can ease the situation. Make different strategies and try them out one by one. There might be no single strategy that always works. Check the person's eyesight and hearing. If they require glasses or a hearing aid, make sure they are clean and in good working order. If nothing seems to help, talk to a doctor or counselor for advice. Tips to address more specific situations are as follow. For aggression triggered by contact with you or other people, always speak gently and calmly. Reassure the individual and let them know that you understand their worries and frustrations. Listen and don't argue, even if what they're saying is wrong. Try to be as patient and understanding as you can. Give specific suggestions and emphasize participation. Instead of saying, "Stop messing up the dining room," say, "Let's set up the tables." Give a few options to have a sense of being in control. For example, do you want these gray dress pants or that black jogging pants? Make sure the environment is quiet and calming. Avoid too much stimulation. Ask one question at a time and give simple instructions. Say, "Did you have a good sleep last night?" Do not say, "What you ate at supper." Did you have coffee? Did you brush teeth before bedtime? Say, put this sugar in this coffee. Do not say, make a coffee, please. Reminisce with the person. Alzheimer's patients might not remember what they ate a few minutes ago. However, they still have a vivid memory of childhood. Talking about their joyful moment in the past is an excellent way of nurturing a good relationship. For aggression that happens during things like bathing, dressing, toileting, or eating, break the task into small steps. Offer one instruction at a time. Be patient and don't rush. Explain what you're going to do clearly, and watch their reaction. For example, when you are face to face, say, I will wash your hair, and then pay attention to the response when you show the shampoo and start washing. Give them basic options to choose from. Do you want black coffee or sugar and cream in it? If no answer, pick one option and watch the reaction. Try to do tasks such as bathing, dressing, and eating at the same time every day, but be ready for changes according to the patient's wish. Maintain a daily routine, but be flexible at the same time. For aggression triggered by their surroundings or routine, minimize noises, activity, and clutter in the environment. Hide doors with cover. For example, place a bookshelf picture to cover the entrance door so the patient doesn't see it as the exit. Minimize caffeine and taper off alcohol consumption. Turn off the TV or radio when talking to the patient. Use gentle illumination indoor. Place familiar arts and photos in the house. Divert the attention with relaxing music, reading, going out for a walk, etc. What to do if you think they might hurt someone? Here are some suggestions for keeping everyone safe. Hide or lock up dangerous items. These include weapons, knives, glass, and sharp or heavy objects. Distract the person with snacks, favorite music, etc. Give the individual personal space and keep a safe distance. In general, it is not a good idea to restrain someone with dementia. The action can only make the person angrier and cause injury to the individual and yourself. If you must restrain them, ask help from another person if possible. If there is the potential of serious injury, for example, the person is holding a knife, call the police. Check for injuries and seek treatment after the individual calms down. If there are repeated incidents, get advice from a doctor or other healthcare professionals. A quick reminder, this video is for information only. Please seek medical advice from appropriate healthcare professionals. If you like the video, give it a thumbs up and share it with your friends. Please share your strategies and thoughts on coping with agitation and aggression in the comments. If you want more information on topics of older adult health, subscribe to the channel